Hi, my name is Boes. I grew up in Emmitsburg, Iowa. I'm the director of the non-invasive brain stimulation program, and we're involved in pre-surgical mapping, so mapping out areas that control movements and speech for people who are destined for neurosurgery. And then the other thing we do is treat patients with depression who haven't responded to medications. The typical patient would be an adult who has had severe depression for several years and has failed somewhere in the range of 4 to 10 medication trials. Sometimes they've tried ECT or other therapies, and they're ready to try something new. TMS stands for transcranial magnetic stimulation. The way that it works for treating depression is you're inducing a small electric current and you do it repetitively. And when you do that repetitively over the course of 40 minutes, it actually changes the excitability of the brain in the spot that you're stimulating. So we stimulate an area of the left frontal lobe, which is involved in mood. And the idea is that neuroimaging studies have shown that that's an area that's underactive or less active for people while they're depressed. And this form of stimulation has an effect of exciting that area or making it more active. So by doing that every day of the week for 4 to 6 weeks, you're actually causing a more durable change in the brain, and that's been associated with improved mood. It's not a cure for depression like I wish it was. So it's a treatment, and it usually lasts several months. So it tends to have a durable response, but the true duration varies a lot. I would say somewhere in the range of 6 months all the way up to 2 years would be typical. And often patients who responded to a first treatment course will do very well with the second one, should they need it. The thing most gratifying about treating patients with TMS for depression is that these are patients who have often suffered from a really debilitating illness for years and years and tried several medication trials that were unsuccessful. And just to see the transformation that can happen over a 4 to 6 week period is really gratifying. So we'll often check in every few days, and you can notice just a gradual change, and the patient will notice it as well and say, that they feel like they've gotten their life back, which is an amazing thing to see as a physician.